With tracheostomy, the whole process of decannulation. The term decannulation means removal of the trach tube. We don't say we extubate the trach, we decannulate the trach. 3 different ways to do this. One is to use progressively smaller trach tubes. So if I have an 8 tube in, I go down to a 6, then I go down to a 4, and I pull it out. Okay, so gradually getting smaller. This happens to be a fenestrated tube. So at the back of the tube, there's some openings, and I'll show you here. Okay. So what we end up having to do is we're gonna, one option is to go progressively smaller. A second one is to cap, and a third one is to plug. Okay. So in this case, I'm gonna go ahead and take my regular inner cannula out and put in my fenestrated inner cannula. Then I'm gonna go ahead and deflate my cuff. And in this case, I cap it. Now they're breathing through their upper airway. So instead of having them have the trach collar, I'm now going to put them on a nasal cannula. Okay. Same thing is true if I want to use an alternative. And with this one, this is called a plug. I take out my inner cannula, cuff is deflated, I go ahead and I just screw that on. Again, they're using their upper airway to breathe. The last one is a speaking valve. And patients with basically what it is, it's a one-way valve. So gas can go in, but it can't come back out. So when this is on, we are going to use the trach mask still. And when they breathe in our humidified oxygen. When they exhale out through their normal airway, so long as the cuff is deflated. That's the key part for all of these. If you don't have the cuff deflated, you're going to suffocate them. Minor detail. Now, if my mother-in-law, you're certainly welcome to do that. The last step then is to go ahead and decannulate and remove the trach tube itself. Again, get all my hygiene as far as suctioning. I'm going to go ahead then and loosen my trach ties, deflate my cuff, and it's just a matter of pulling it out. Once it's out, I'll go ahead and apply a bandage on it so that it gives it time to heal. Okay?
No.
Pardon me?
We don't do any stitches or anything? No?
Nope, it'll close off on its own.
No.
Now, there are some patients, say, who have had their larynx removed that have a permanent stoma, and that they make the hole large enough so that when it granulates, it'll actually stay open permanently. We'll talk about laryngeal tubes next time. Okay. That's it.